I first discovered the bridge device about 1.5 years ago through one of my support groups for recovery. There was a gentleman that was being filmed by a provider in the lower 48 coming off of Suboxone. And when I first seen the device and I seen his experience with it, it was something I was very shocked to see him go from feeling very sick to feeling better. So I was really stunned to see that there was this type of device out there. And so I immediately contacted Taria and a couple other friends in our recovery community. And Taria immediately messaged me back and said, there's no way. And I agreed with her. I said, there's no way that there's a device out there that's going to help somebody get through an opioid detox. It is the toughest thing to get through when you're addicted to opioids.
I couldn't believe that it actually would take away detox. And so what I did was I did my research, and I kept researching and watching videos and watching how the bridge would actually take away the withdrawal symptoms.
Several of us were doing this in our own home prior to the discovery of the bridge device. We've been helping people detox because we live in the second largest populace of the state of Alaska, and we've never had a detox center in our region. And so we're Alaskans. We weren't going to wait for somebody to build us a shiny new hospital or come rescue us. We partnered together through a whole lot of prayer and a whole lot of showing up, just being willing to be a spoke in the wheel of the change that we want to see in our community.
After following it for a little while, I reached out to Innovative Health Solutions, who are the patent holder and distributors of the bridge device.
Through a lot of dialogue with other people that shared the same passion as us, we came about forming this non-narcotic approach to helping people get through the detox piece, because that's always been the biggest hurdle that we've faced, is people don't want to suffer through the pain of detox.
The one patient that really stands out to me is patient 1. I first met patient 1 when I got a call from Aquila. While meeting with him, I was I observed his behavior and stuff. He was very interested in getting fully clean and sober. He was taking pain medication and obviously, methadone, and he was getting it off the streets. And he was extremely emotional. Had a lot of shame when he was talking about it. Didn't want to come out and talk about how he had, how he was addicted, and he hid it from his fiance for quite a while. You guys have been in a relationship a long time, so she's probably in a place of bitterness right now because of this process that you've gone through, and she doesn't understand it.
She knows what it does. And like I said, her mom died from it. Her dad was he was an opiate, but he was into crack and beating up her mom and stuff. And
so that probably
that's where it puts the big bitterness into her. It's a life that she doesn't want to live.
And that's understandable because of her own experience. And she loves you, so she doesn't want that to happen to you, so you have to kind of understand her position too. So a mutual thing. Is she in class right now?
She told me good luck and hope everything goes good today. I don't know, maybe I don't know how to accept the talking to her of it, because I've hid it for so long.
And when did she find out?
December 15th, day before our engagement.
And so with tears and and talking to him, I went ahead and accepted him into the project, and because he had been taking methadone, we had to wait.
You're here for the bridge and Opioid Withdrawal, and I congratulate you on doing this because it's not an easy thing to do. I heard in your history that you took methadone yesterday. At what time?
At 8. It was, well, I had an appointment at 9 in Aquila, so it was like 8 to 8:30.
8 to 8:30. Okay. So this is the issue. I am going to take you into the program. I'm going to do your physical exam today. What I would like you and Terry to know is the clinical opioid withdrawal scale is not sufficient for you to have the bridge today.
And by the second day, he was at a clinical opioid withdrawal scale of 20.
Tell you what, it's a lot easier to fucking get high.
In the short term, at least, right?
Which is half of, it's, the scale is 40, so he was at a 20. Super angry, cussing, which is typical for somebody that's withdrawing because they're irritable. And
Are you feeling?
Yawning all fucking day, all night. I woke up with so much goo shit in my eyes, I had to have my fucking rag wash them off.
Okay. So you're obviously feeling irritated and anxious, which is understandable.
when Dr. Freeman came in to do the application of the bridge, this was my first visual that I was going to see somebody getting the bridge device on.
How you doing this morning? Feeling a little rough, right? All right. Well, good morning, Terry.
Morning.
In learning the whole process, when we were working with patient one, this was our first application, and of course we didn't know this was going to be our go-to. I mean, our first try. Patient one, obviously he's sick, and he's sitting over there just kind of like, what's going on? And I can imagine what's in his mind, that, oh my gosh, this bridge device is not going to work. And we were babies at this. And now it's not even like that anymore. We just go in and put it together, and the bridge is applied, and bam, it's a wrap, and it's a done deal.
Press this against you. Hold it for 10 seconds. It's a little prong, so you're going to feel a little stick.
Does it just automatically come on once it's plugged
Once
in?
it's plugged in, it should.
So this is the last one. Okay.
Are you feeling a little bit better?
Mm-hmm. I feel really warm.
Yeah. Good.
I'm breaking a sweat.
We can give you something to drink, make you a little bit more comfortable. Sorry, I'm touching it.
We'll do another set of vital signs and another assessment in about 6 more minutes. So now that we have it placed in and it's working, and he can definitely see some of those benefits, we're going to go ahead and do a reassessment and do that every 10 minutes for the first half hour and see how that progress goes along. It's really exciting.
Patient one once it was applied, he was just his whole countenance and everything about him changed. He was smiling, he had a really great attitude, and he walked out of there like feeling normal.
And then your stomach is still good? No problems with your stomach at this point?
Just growling because it's hungry.
Okay, so your appetite's coming back. You did mention you had no appetite when you came in. That's an improvement. Then let's take a look at your hands, see if you're still steady. And you are. And I haven't seen you yawn. How is your anxiousness and irritability? Are you still feeling a little bit, or are you just kind of cool as a cucumber?
Alright.
Feeling good?
Yeah.
Okay. And then let's take a look at your skin, make sure it's still smooth. No goosebumps.
I just feel warm.
It's warm, huh?
Not really sweaty, just warm from like the top to like my waist, like my belly right here.
So, you are officially at a 3 at 30 minutes since the application. How are you feeling overall?
I feel good.
Good? You look like you feel better.
I do.
Yeah.
I don't feel so angry.
Yeah. Your eyebrows
I
are
don't mean
not
to be
kind of
rude to you.
squished down.
I'm
You
ready
weren't
to kill
rude.
you
weren't rude.
for asking me questions.
I did not take it personally.
Well, within a couple days, I get a phone call from Fiend to Clean late at night that patient 1 was super sick and he had to pull over to the side of the road. He couldn't drive to the hospital. He was throwing up, and that the bridge wasn't working. And so I met Carl from Fiend to Clean at the emergency department, and of course the emergency staff had no idea what the bridge device was or how to deal with it. And you can tell that they have what we call compassion fatigue because they see it all the time. And so they were totally irritated, and they were saying, well, we'll just give you Toradol, and you know, this is a continuous thing that they see. And I'm trying to explain to them, well, he's wearing a bridge device and it's supposed to take away the opioid withdrawal. And so I'm thinking that the leads came out, that the prongs came out of his ear. And of course I'm in a hospital, but I'm not a medical provider. So I was just like, you know what? Screw it. And I walked right over and I checked the prongs, and sure enough, the prongs had come out, and the staff, the medical staff, was ready to give patient 1 Toradol because he was kicking and he was just clawing at himself and he was super sick. And within a minute and a half of me pushing those prongs in, he was sitting up and smiling, and all his symptoms were gone. And it was so powerful to witness that even the medical staff was like, what is this? What is this thing? I mean, I can't believe that I'm seeing his withdrawal symptoms disappear. And he's like, I don't want the Toradol. I don't want nothing. I'm ready to go. Just check me out of the hospital. He was just ready to go. He was like, it's working now. And so we call that the pinch test. We have to tell all the patients, you got to do a pinch test because sometimes when you're moving around, the leads and the prongs come out.
Fact,
Okay.
yesterday I had a pretty long talk with someone that I bought from for a long time, and his whole family's wrapped up in it. Everybody, brothers, dad, mom, everyone. And I was like, what do you think about, like getting off of it? And he's like, oh no, I'm gonna stop taking these Roxys, I'm gonna go back to Vicodins, and then I'll quit Vicodin. I said, no, you're fucking not, dude. No, you're not. Because 2 years ago, you were telling me that you couldn't even take a Vicodin, you're puking. Now you're taking 4 Roxys a day. Ain't fucking happening. And he's like, well, let me think about it. And I was like, okay, well, just let me know, because I met this awesome fucking lady that will maybe help you. Like, we'll see. I don't know. He's just too proud of himself, to go to the breakdown, I guess, and do it. And that was my same problem.
Well, and you'd
Just-
never done it before.
Yeah.
You'd never reached out and asked for help. But the first application was very memorable. It's my most memorable application, just because it's near and dear to my heart. I had to see how this worked, and because of my own personal story and my own personal experience with opiates and then loss of my son, this was just surreal to me. So patient 1 really stands out to me the most.
Well, it's good to see you taking a good first step forward and getting good results from it. I look forward to
I got a
working with
boat
you.
to buy in a year.
Vivitrol.
You what?
Said I got a boat to buy in a year.
Got goals.
Yeah.
No more worrying about monthly fucking bills.
Patient 1 is he's the leader of the pack. He was the first one to dive in, and he's been doing great. He's on, I think, his 3rd Vivitrol injection now, and the outcome of really utilizing the resources has been really pivotal for this patient. And I'm just really excited to see what comes with all the rest of the patients who are coming through this program.
Thank you very much. Appreciate it.
Thanks for the
You know, he saw this with his girlfriend online when we did the interview on KTUU, and he said, oh, only 25 patients are going to be allowed to do that. There's going to be so many trying to get in. There's no opportunity. There's no way I'll be able to do it.
He's the first one?
Yeah, I know.
I think.
Oh, congratulations, Terry. That's
Thank you.
awesome.
I want to hug you, yes. Oh my gosh, you're
Happy
awesome.
birthday.
Oh, thank you.
It was a lot cheaper.
Thank you so much for participating.
Oh, goodness, what a privilege.
In your heart.
Thank you. No, I appreciate it.
Yeah.
You're inspiring.
Oh, well, thank you.
Thank you, dear.
The Bridge device, while it's an amazing tool, it is not a fix-all, it is not a cure-all. It will help an individual get through their opioid detox, but there has to be a whole protocol in place. And the Matsu Opioid Task Force and all of our partners came up with a foolproof protocol so long as the individual is ready to fully surrender and commit to this process.
We don't ever just tell people that, no, I'm sorry, we can't help you. We try to unpackage their individual needs and steer them in a direction that can best help them for what they're going through. And so typically, if people do meet our requirements, then we'll go through an assessment with them and do a drug screening, make sure that everything lines up, and then we'll set up an appointment with the Algon Interventional Pain Clinic to do their bridge application.
The Matsu Health Foundation has funded this program for these individuals that are fully ready to get through the entire process, which means a minimum of 6 months of Vivitrol. They have peer support, they have faith-based peer support, they have church that they can attend, they have outpatient treatment through one of our providers, and a continuum of care. One of the biggest things that I think is crucial in this is the peer support, because without somebody, helping you and assisting you through this and caring about you and loving you and being compassionate and understanding, it's really hard to maintain your recovery.
So I've received a lot of questions since changing gears and starting to work with addiction medicine, and a lot of them stem from wondering why I choose to work in this field. Why do I continue to work in this field when it's notoriously difficult to do so? And I think that my reasons are probably a lot of the same reasons that all of you have. It's worth it. These are lives. These are lives that matter, and these are lives that may not have intentionally gone down the path of opiate addiction or other drug addiction, but these are human beings, and their life matters, and they have family, and it matters to their family, and every life is valuable.
I'm a person in long-term recovery, and I've been clean and sober for over 12 years from pain pills, heroin, and methadone. We have an opioid epidemic, and I am pleading with you to recognize those that are in long-term recovery and live in complete abstinence. The general protocol is to utilize medically assisted treatment, which would include methadone, Suboxone, and Subutex. And data is collected on that. I would really like to see some funds generated for those that are wanting to get completely clean and sober by utilizing the Bridge and Vivitrol, which is a non-narcotic medication. It's an opioid blocker, 28 days. Every 28 days you get the shot. And it also eliminates cravings.
So if there's one thing I could say to the powers that be in this country, is that there's a whole lot of us that you probably haven't heard from that are daily out dealing hope. We're actually helping people get out of their the entrapment of their addictions. And so my plea to you is that you would talk to more of us, because we have solutions and we're making a difference, and we'd just like to help you help us make that difference.
We have a new generation coming that is more addicted and more risk-taking than ever before, and we need to have protocols set in place so people are ready to enter into recovery.
What I would really like to see is for those that want to get clean and sober, fully off of it, and they are ready to not, and they don't want to utilize methadone or Suboxone, they be able to be given the opportunity to use the Bridge and Vivitrol so that they can get completely off of all substances. And I'm just pleading with you to consider that. I've seen this device work. I've been in the room with the patients, and this is near and dear to my heart, because When I wanted to get clean and sober and I wanted to get completely off of all substances, there was no help. And now we have hope. This device does help, and it takes away 75 to 100% of the detox symptoms. Coupled with Vivitrol and a continuum of care of peer support and treatment, this protocol does work. And I'm encouraging you to, and begging you to consider taking a look at this as another option for recovery.